Hello, I am Dr. Girish Bhalerao. I am orthopedic surgeon and consultant with Wockhardt Group of Hospitals, Mumbai. I have completed my MS, DNB and D Ortho, and for my advanced further training, I was in foreign fellowships, from which I have done my sports medicine fellowship in FIFA Center of Medical Excellence, Portugal. I have completed my joint replacement and arthroscopic fellowships in King's Medical College, London. I have also been trained for revision arthroplasty surgeons, that is revision joint replacement surgeries from Helios Endoclinic, Hamburg, Germany. I have also been trained in advanced robotics and computer assisted navigation surgeries from Scotland at Golden Jubilee Hospital, Glasgow. So my specialization lies in joint replacement and sports medicine surgeries, that is arthroplasty and arthroscopy surgeries of hip, knee and shoulder. So my total years of experience in the field of orthopedics is more than 12 years. My specialization lies is that we do a very customized joint replacement. We do minimal invasive procedures. We do computer assisted navigation surgeries. So all these techniques can be conferred to the patient depending upon his particular body type. We do a very small incision surgeries in which the muscles are not disturbed, the blood loss is minimal and the recovery is faster, to such an extent that our joint replacement patients stands and walk on the same day, and they require hospital admission of typically 2 days after the surgery. Within a week's time, the patient is mobilizing and doing all his activities of daily living on his own, and after stitch removal he can perform his activities even going outdoors and the routine activities. We make use of computer assisted navigation, in which we operate and take help of a computer assisted laser technology, in which the sizes are appropriated and a better results can be achieved in the same duration of time. So I also specialize in doing keyhole arthroscopic procedures for sports medicine related injuries to ligaments in and around the joints, which may cause instability to the joints and create a very dysfunctional joint for daily routine activities. These injuries are typically found in patients who have involved in some sports medicine or like sports injuries like some football games, badminton, etc. We use a very minimal invasive keyhole procedure in which a small 1 cm incision is made and instruments and cameras are passed through this 1 cm incision to correct and replace a particular ligament. Being trained in international platforms of FIFA Center of Medical Excellence and King's Medical College, we at Wockhardt Hospital apply all these international protocols to all our routine patients to not only enhance their post-op rehabilitation but also to give a way of living and how to utilize their joints in adjunction with the other joints, so that they perform their activities of daily living with more ease and with better enhancement.